Dr. Shannon M. Clark here. I'm a double board certified ObGyn and maternal-fetal medicine specialist. And one of the questions that I have been getting a ton lately is this. If I had PGT tested embryos during my IVF procedure, do I still need to get prenatal genetic screening testing? And the short answer is yes. Before I go into why from an MFM standpoint, I'm going to throw this over to my bestie, Dr. Lucky Seacon, who is a double board certified reproductive endocrinology and infertility specialist, to give you some info on PGT testing.
Hi, I'm Dr. Lucky Seacon, a double board certified ObGyn and REI. Many of the IVF cycles that we do nowadays are utilizing a technology called pre-implantation genetic testing, or PGT. 5 to 7 days after fertilization, an embryo has approximately 100 to 200 cells that line the periphery that one day become the placenta, and the cells that clump together that one day become the baby. We can remove a few of the outer cells that will one day become the placenta and send that off for genetic testing. Most commonly, we are testing those removed cells to count the number of chromosomes in each of those cells. So this helps us to select the best embryo for transfer that has the best chance of implanting and the lower risk of miscarriage. A lot of embryos can form from our eggs and sperm that are missing or have extra DNA that they shouldn't have, and this is the number one mechanism behind first trimester miscarriage. When I discharge my patients after they've conceived from IVF with PGT and they're going off to their OB, I tell them, pretend as if you did not do this testing and consider all of your options when it comes to genetic screening or testing during your prenatal care. While PGT is highly accurate, there is a less than 2% chance of error, but you can't exclude it 100%. Additionally, PGT is based on a very limited subset of the total number of cells that make up the embryo, and it has limited resolution, so we may not be getting the full picture. We have a limited amount of DNA to work with, and it may not be representative of the actual embryo that contributed to the pregnancy. So it always makes sense to at least double check by doing some screening in the first trimester, and it's important to consider all of your options and not be blinded to them just because you use PGT.
Thanks, Dr. Seacon. Now I want to talk about this SMFM statement, which included a checklist for pregnancies resulting from IVF. Regardless of whether PGT has been performed, they recommend all patients who have achieved pregnancy with IVF be offered prenatal genetic screening and diagnostic testing via CBS and amniocentesis. Now, prenatal genetic screening testing would include something like a quad screen or cell-free DNA, which is also referred to as NIPT or NIPS. Now, regarding pregnancies that resulted from IVF of PGT-tested embryos, we don't have enough data to know how much a PGT-tested embryo that was normal lowers the risk of a chromosomal defect or abnormality in the developing fetus once a pregnancy occurs. We also know that false negative results can occur from PGT testing. And I just want to wrap this up by saying getting cell-free DNA testing, or the NIPS or the NIPT, is not diagnostic. It is still a screening test. I hope this information helps.